Hey everyone, my name is Alexis Hunter. I'm the community liaison for Wilmington Health, and I'm joined today with Dr. Jayme Stokes, who is a general surgeon on the Wilmington Health surgery team. Dr. Stokes, thanks so much for being a part of this conversation today.
Thank you for having me. It's a pleasure to be here.
Yeah, absolutely. So tell us first just a little bit about your education, about your experience before coming to Wilmington Health.
Sure thing. I grew up in Greenville, North Carolina, so I'm an Eastern North Carolinian by heart. I went to undergraduate in medical school at the East Carolina University up in Greenville, and then completed my general surgery training at the University of Virginia, and then did a fellowship in laparoscopic and bariatric surgery at the University of Virginia as well. I spent about 5 years at a community hospital in Charlottesville, Virginia, and then I've been fortunate to return to Eastern North Carolina and be a part of the Wilmington Health family.
Awesome, that sounds great. So Dr. Stokes, one of your specialties is foregut surgery. So tell us a little bit about what that means and who may benefit from that type of surgery.
Thank you. Foregut surgery encompasses really all of the surgical techniques that we use for diseases of the stomach, gallbladder, some liver surgery. The most common patients that we'll see in the foregut specialties are people who need surgery for reflux or heartburn disease that is not responding well to medications. They may be people that have tumors or lumps on their stomach, or they may be people who have what we call a hiatal or a peri-esophageal hernia, which is where part of the stomach has relocated itself from within the abdomen or within the belly and has slid up through a hole and into the chest. And those patients can have difficulty breathing, they can have difficulty eating and swallowing, and I can, through various means, repair those situations as they arise.
Okay. So one of your specialties is also treating hernia. So tell us about how hernias develop and how a patient may know that that is what they're experiencing.
Hernias in general are a weakness or a hole on the abdominal wall. So they typically occur somewhere on the abdomen or the belly of a patient. For a patient who's never had surgery before, we typically see them at the belly button or in the groins on the left or the right side. Most patients will notice a bulge first. They may have a little bulge or prominence at the belly button, or maybe down in the groin, they may have a bulge that pokes out that they can easily push back in. Sometimes hernias cause some discomfort, maybe a little pain, maybe a little soreness, maybe some fullness. Typically those symptoms will be worsened with exercise or activity, some heavy lifting. We can certainly talk to patients about their options, whether it be supportive measures with compression garments or avoiding physical activity that is strenuous, or for patients who need surgery, we have a whole host of surgical options to repair hernias. There's also patients who have had surgery on their abdomen for other reasons. Maybe they've had their gallbladder removed, maybe they had a part of their colon removed, and they've developed a hernia in that surgical site or that wound. And those patients can also undergo surgical repair of a hernia there if needed.
So the whole team of surgery specialists at Wilmington Health, tell us what makes the Wilmington Health surgery experience stand out in our community.
I think it's just it. We are a community, and Wilmington Health is a leading member of the community. One of the best parts about being part of Wilmington Health and being part of Wilmington is just that sense of family. We get patients not only from Wilmington, but from the surrounding counties. It's great for me to sit down and talk with them about their personal experiences, their jobs, their lives, their families. And you really feel like you're a member of their family, they're a member of yours, and you're in the community. And I think everybody in Wilmington Health, and certainly in the surgical services, thinks that way as well.
Absolutely, absolutely. Well, thanks for chatting with me today, and for all of those watching, the information on how to schedule with Dr. Stokes is going to be found in the description of this video, and the entire team of Wilmington Health looks forward to providing excellent care for you.